What is frontotemporal dementia, FTD, and its progression? Frontotemporal dementia, often abbreviated as FTD, is a rare and progressive brain disorder. It primarily affects the frontal and temporal lobes of the brain. These areas are crucial for our behavior, personality, language, and movement. Unlike more common forms of dementia, such as Alzheimer's disease, FTD typically begins at a younger age, usually between 45 and 65 years old, but it can occur earlier or later. As FTD progresses, it causes gradual damage and shrinkage of neurons in these brain regions. This leads to a decline in mental abilities and noticeable changes in behavior and language. The disease usually progresses slowly over several years. Symptoms tend to worsen as more areas of the brain become affected. The symptoms of FTD can be grouped into several categories. First, there are behavioral and personality changes. Individuals may act impulsively or inappropriately, show a loss of empathy, neglect personal hygiene, or experience changes in eating habits. Some may overeat or even eat non-food items. These changes can make social interactions and daily activities quite challenging. Next, language difficulties are common. People with FTD may struggle with speaking, find it hard to form words correctly, or mix up word order. These language impairments can significantly affect communication, making it hard to express thoughts and feelings. Cognitive problems are also a key feature. Early on, individuals may have trouble with planning, organizing, and concentrating. Interestingly, memory issues often appear later in the disease, which is different from Alzheimer's disease, where memory loss is an early symptom. As FTD advances, physical symptoms may emerge. Some individuals might experience muscle weakness, stiff or slow movements, difficulty swallowing, and loss of bladder or bowel control. The progression of FTD can vary from person to person. It often begins with one type of symptom, like behavioral changes or language problems. Over time, additional symptoms may develop as the disease spreads through the brain. Eventually, individuals may become increasingly reliant on others for daily care. The time a person lives after diagnosis can vary widely, ranging from less than 2 years to over 10 years. Currently, there is no cure or treatment that can slow or stop FTD. Management focuses on alleviating symptoms and supporting the person's quality of life. This can include behavioral strategies, speech therapy, and supportive care. Understanding FTD is essential for families and caregivers. The disease impacts not only memory but also fundamental aspects of personality, behavior, and communication. This makes it distinct from other types of dementia. Early diagnosis and tailored care can help manage symptoms and improve daily functioning for those affected. Always consult healthcare professionals for personalized advice and support.